caffeine shots. So, good evening, everyone. It really helps us, especially the speakers, when we see audience are engaged. Actually, we also try to engage with our boring presentation, but still, I really want everybody to participate and do ask questions. Even if I'm not able to answer, please do ask questions. I really want those questions to taken up, and then really I want to give a thought after that. But we'll try to answer all your questions. I was given a topic on the VOC. So when we talk about VOC, it is obviously it's a very different, I would say, thought, or it's a very different vertical, or it's a very different program in each organization. So when I talk about VOC, we all want to learn, we all want to listen to our customers' VOC, but purely I'm talking from my experiences, so don't take it or make it as a statement for everyone. So when I talk about VOC or anything, especially from a service point of view, when I go back to a lot of my leadership teams and talk about what my customers feel what VOC is, so at times they are in a dilemma. Okay, I really want to do this for my customer, but I really have to take care of my P&L also, right? So when we ask for money, when we ask for budget, or when we ask for some extra, I would say, services to offer to customers, at times you will feel, or maybe I have gone through those experiences. I'm not talking to any particular organizations. This has happened during all my career. I've seen that. Even I was a part of the retail team where customer service and I would say P&L was my both KPIs I was handling, and I knew how to balance in between both of them. So I will just talk about that, but before moving on that, I want to share some interesting facts with all of you. So I'm sure you can see the screen. It says more than 50% of innovation actually comes from VOC, right? I read this, obviously it comes from Google only. I read it and I actually captured because I liked it very much. And especially when I talk about healthcare domain, definitely this fits a lot to us. 73% of customers definitely want to ask or want people should come and ask for a feedback as soon as they have experienced any service. So this is very important. Apart from that, one more data which actually is very interesting is on your right. 86% of our customers will leave the brand or the product even if they get only 2 worst experiences, or the experience which they were expecting, it did not match up to their expectation. So this is what actually has come from the various surveys. So when we talk about VOC, what VOC actually means, it means expectation of a customer, right? What is the experience we are giving against that expectation, that translates into VOC. It can be positive, it can be negative. Okay, so moving on to the first topic, which is, I would say, the subtopic, best way to manage customer services. Okay, when I talk about customer service here or customer experience, the first and the foremost thing is, do we really know our customers? We talk about digitization, especially healthcare. I was very overwhelmed with the last session on healthcare, where Deepika was talking about and asking those tough questions. I was very impressed and I really wanted to participate in that. But then I realized those questions are very true, especially in healthcare. It's an evolving, I would say, sector right now. A lot of sectors like telecom, IT, e-commerce, they've reached that kind of a level. And I would say healthcare, I worked for telecom also. I have spent 10 years and with one of the best organizations, I would say, in telecom. I worked with Vodafone India. After working there, I realized when I moved to healthcare, that switch was not easy for me, because it's like healthcare is almost 20 years behind as compared to telecom. So first of all, we really need to understand our customers. That's very important. Are we really focusing on customer data? And when she was also mentioning that data in healthcare is very haywired, obviously, because till date, I would say a lot of doctors, they would love to write prescriptions manually. So when they write prescriptions manually, how do you translate into, we have come up with such kind of solutions in Apollo. We have given a pen to doctor to write and it translate everything into data. Those kind of innovations we have also done. But I tell you, there is a problem. It's not, and it's a good problem to have. We are still focusing on that. Lot of doctors, they don't want to share their customers or patients' data. They feel that my patient will go to some other doctor. Trust me, seriously. And there is one live example, I would say. If you go to any star doctor, a doctor who's very well renowned, you will find his secretary or her secretary is there from a long time. Since the day the doctor started practicing till the time he retires, doctors never retire, by the way, that secretary is attached to. So it's like a second wife. Seriously, I have seen it, and this is a problem we have in healthcare, and it's a good problem to have, and that's how that's a challenge, and we take this challenge very openly, and we work towards with our team on improving the digitization and all the modes, evolving the entire healthcare. It is taking time. So what do? We understand, first of all, we need to understand that data, get that data into system, understand, analyze data, what patients like, what they don't like, what they want, how can we improve, where they come from, what kind of a social media. Till now also, we are moving into that direction. We've started analyzing data from social media. Can you understand a patient who's coming to you, how relevant is for us? It is definitely relevant. We go back, backtrack, check what kind of comments they are giving us. What are they talking about Apollo? So those kind of data we try to collect, and basis that we try to create a customer journey map. So that customer journey mapping is very important in healthcare, especially in a hospital. And after that pandemic, it is very, very, very important how customer is actually with us and till what point, why is he leaving. So BOC really helps in creating that database, in creating that customer journey map. Next is very important. I think this is one point which I was just referring to, why a doctor is having a secretary who is attached to with that doctor for a long time. It's because doctor really want, and there is a human connect till date. You cannot eliminate that human connect. Even if you want, you won't be able to do that. Despite pandemic, despite Apollo coming with 24/7 app, you can do and consult online, telemedicine. Before pandemic, honestly, when my CEO used to talk to me about telemedicine, I'm not talking about this organization, the previous one, he was very passionate, he is still very passionate about telemedicine. But I realized that I told him, sir, it will take ages for India, like a market like India, to evolve, come to a level of a telemedicine. But trust me, and this I really learned, and I realized after pandemic, it changed. It changed. And you won't believe, Apollo came up with this 24/7 app. During pandemic, we integrated all our channels. So we had multiple channels. So what we did, all our pharmacy, Apollo Pharmacy is one separate channel, hospitals one separate channel, Apollo Clinics, dental, you have Apollo Diagnostics. So what we did, we integrated everything together. This is too quick. Sorry. This is my first slide. Sorry. Okay. So moving on to next. So we integrated those channels. Why? There was a reason. We wanted to give a complete seamless experience. I will talk about more in the coming slides. I'm sorry if I take more time. Now, obviously, the next point is understand ever-changing customer behavior and requirement. Okay, how do we understand our customer? I just spoke about it. We need to understand first of all the data, what he likes, dislikes, work towards it, create a customer journey. At Apollo, we used a lot of social media. You will see a lot of, not about Apollo also, healthcare providers, they have actually moved to social media now, especially post-pandemic. They realize now customer or a patient would not like to come to a hospital, seriously. I have this option available. One of the best solutions, I really want to pitch this app to you. Please download, use it personally. Apollo 24/7 app. What is going to happen? Let's say you want to consult a doctor, you're sitting in Bangalore right now, you want to consult a doctor from Chennai, right? You can do it from that app. And you have that option to pick up a Chennai doctor with more experience and a lesser fee. Doctor in Bangalore may be charging you 2,000 rupees with similar experience, but in Chennai he can charge you around 1,500. Go to Bhubaneswar, he'll charge you 700 rupees. So this is what Apollo 24/7 app has given to the customers. That is what we've tried to create, those kind of solutions for our customers. Then apply those data. Now when a customer or a patient has used our 24/7 app, he's done some consult online, we have this data available. Apart from that, we are pitching a lot of, upselling a lot of things. As soon as that consult is done, there is no handwritten prescription come. Doctor will type in everything. It will come automatically on the handset of as a WhatsApp prescription to the patient. Apart from that, he will automatically receive an SMS with the detail, with the medications prescribed. My doctor should be able to see the last interaction. So that is the kind of integration we have done. This really helps us to apply data from one channel to another and make the experience very customized for the patient. Third point which I really wanted to speak, or I was made to speak on this, is identify the root cause of any customer experience issue, right? We all do. RCS, we'll talk about RCS. So if we really want to do RCS, how should we do it? Or how we do at Apollo? So there are a lot of cases which are related to the medical experiences. So how do we do? First of all, we build up a team. So it depends on every case-to-case, scenario-wise scenario basis. We pick up scenarios. Let's say there's a complaint. We go back, check which is the right person who is going to help us in providing us a RCA on this. We came up with a team. We define a team, and then that's how we do it. So in a hospital, you'll generally find a medical director or a medical superintendent who handle those cases which are related to the patient medical issues. But apart from that, there are a lot of issues which are there or currently patient. You won't believe the number of complaints which we get. We only get 5% of cases related to medical complaints. 95% complaints are purely related to experiences. And those experiences, again, why patients are raising those complaints or issues, I'm okay, I'm very happy with it. Because healthcare is evolving. Now customer is coming there, he's not coming for a doctor now. He wants doctor, but he wants a great experience as well. So it has to be a combination of both. So we need to have smart teams who understand customer services and who understands the medical admin part of it. Then gather experience data, what happened, what went wrong. There are two types of basically issues, or I would say when we do RCA, we need to find out things, is operational data. What went wrong? That is purely related to the operations. Okay, high number of escalations, cancellations are there. Let's say he booked an appointment. There is one again data I would like to, interesting data I want to tell you. Out of 10, 4 patients actually don't come back to the same doctor if the waiting time is more than 1 hour. Trust me. We have done a survey. We found out if a patient had to wait for 1 hour to meet this doctor, he will happily change the doctor. Though he likes the doctor, he's getting cured, but he will say, okay, I want to move to some other doctor. Too much waiting, I can't. Time is money. So that kind of evolution is happening in healthcare. Why my cancellations are happy to say that we have recently implemented CRM. Before that, earlier, we used to have those outdated, old age, handwritten forms. Patients were given those forms, feedbacks were taken on a form, and then somebody has to do a data entry, and there are smart people in the system everywhere. Okay, knows how to manage a customer experience. So it's about perception. So वो perception कभी ऊपर आता ही नहीं था. And then we realized it's very important to have an increases customer engagement. So getting on the next seat. So we optimize touch point. That's what I just spoke about. So we are taking feedback touch point wise. I have a tablet at the billing counter. I have a tablet in the washroom. I have a tablet outside the OT. I have a tablet outside ICU. So you can give a feedback immediately. Basis that it helps us anywhere. It's by our Bill Gates. It says your most unhappy customers are the greatest source of learning. So this is how you can actually evolve your entire VOC program. I would love if you can go back, ask patients to give, or your customers to give feedback, who's left your organization, who was super unhappy. There's one program which I really want to talk about. In my past experience, we did that. Sorry, I'm so excited to tell you this story. We do this. There is one program, we call it We Are Listening. In my previous one of the organization, we follow this We Are Listening program, where if you had a bad experience in the organization, you had multiple complaints during the stay, you gave so many, you have F&B issues, you have medical issues. You want what we are going to do? My hospital head used to call that customer. Once he's discharged, he's gone back. Things are sorted, bills paid, everything. He's very happy now. Things are sorted, cool down. Now we'll call him back when he comes for a review. Not only the customer, the family member also. We call him for a half-an-hour session with us, where all the HODs of that hospital will sit with the director of the hospital, and he will now talk about how was his experience. So now, starting from appointment booking to the time he's discharged, he's going to give you left, right, center, forward. That's his playground. He's going to hit a 6 on every ball. But we are ready for it. We are ready for it. That's how we improve our patient experience, or I would say processes on the ground. So these are few experiences which I talked about. I did not capture everything in the PPT because a lot of things I really want to talk. So thank you so much for listening to it, and you guys are a great audience. Thank you so much. Thanks.